In the heart of our community, there's a place where miracles happen every day. A place where the dedicated doctors, nurses, and staff work tirelessly to save lives and improve the health of our loved ones. This is the Rocky Mountain Health Center. This is our hospital. And the reality is, our hospital needs our help. The costs of providing the best possible care are rising, and government funding can only do so much. For over 20 years, the Rocky Health Foundation has been taking the lead in fundraising to ensure resources are available for purchasing equipment and supporting programs. And with a new operating room on the horizon, they need your help to ensure it is properly equipped for our loved ones to receive the care they deserve.
My name is Jessica Moncrief, and I'm the site manager at the Rocky Mountain House Health Center. I've been at this hospital for the last 18 years. We're certainly proud of how the center has developed, and a lot of it is due to the work of the Rocky Health Foundation. Our new operating room is being outfitted with their help, and their lobbying efforts certainly contributed to us being granted this new build. Having surgical and scope options available right here in town is an amazing benefit for a community of this size.
My name is Rebecca Dorshak, and I'm the charge nurse for the operating room and endoscopy programs here at the Rocky Mountain House Health Center. Red Deer is the closest hospital that offers many of our services, and if we were unable to continue them here, this is where our patients would have to go. In addition to more obvious benefits, there's a real financial benefit in saving travel costs, hotels, and meals that would often have to be incurred, both for procedure as well as for the follow-up care.
Yeah, so we were expecting our first one in 2003, and I received all my care at the medical clinic in Rocky, and it was phenomenal. I had Dr. Saunders, he's since retired. Even with the anxiety and the uncertainty and things not going according to plan, I felt very safe because I knew that the doctors there were competent, and I knew they had what they needed to have in place for this baby to be delivered safely.
My name is Bob Jacob. I was born and raised here in Rocky Mountain House. I've been working for West Fraser for over 25 years. About 5 years ago, I had the opportunity to come home and manage the West Fraser LVL mill out at Strachan. At West Fraser, it's important to us to give back to the communities where we live and work. I'm very proud to say that West Fraser has been a financial supporter to the Rocky Health Foundation and its important work. Residents and workers in the region rely on the health center to provide critical services for themselves and their families, co-workers, and neighbors. With over 150 employees, we appreciate having the health center close by in case of an accident or emergency.
My name is Pat Lobley, and I represent the Rocky Agricultural Society. We have been a part of the rural community around Rocky Mountain House for the last 110 years. We are interested in bringing information to those who might be impacted by an unsafe situation at any time. We don't plan to have accidents, but they do unfortunately happen.
My name is Dr. Glenn Burton, and I've been practicing in Rocky Mountain House since 2015. The Rocky Health Foundation's contribution during my 8 years in Rocky has been immense. I use something they purchased on a daily basis, often more than once a day. They have enabled us to grow our surgical program, increase our service offerings, and equip the ER with important life-saving equipment. As with any equipment, the better it is, the longer it lasts. Less breakdowns mean less interruptions and allow for better outcomes for patients. With similar equipment as that of the cities, we are able to offer the same level of service in our community, allowing patients to be treated closer to home.
My name is Dale Shippold, and I'm the treasurer for the Rocky Health Foundation. The foundation strives to support healthcare initiatives that improve the health of everyone in our community. Through the tireless efforts of our volunteers, the money we've raised has made a significant impact in the lives of many residents right here in Rocky Mountain House over the years. However, there is still much work to be done, and we can't do it alone. We need your support. By joining us in our efforts and making a donation, you are currently investing in the health and well-being of those who need it most.
Not having to travel, or not having to travel as far for our rural patients, especially during the winter, not only decreases the stress that surrounds a hospital visit, but also allows for an increased continuity of care. This can happen much easier when your family doctor, specialists, and emergency facilities are all located within the same community. Many of our patients have been able to receive their surgery or procedure where they potentially would have had to wait a year or more in larger centers, and this often has such a direct impact on their quality of life.
Our gynecology and obstetrics program is kept open by the ability to perform these procedures here for our maternity patients. Being equipped to deal with both emergencies and standard deliveries allows women to give birth in their home community and can allow for more family members to share in the experience and provide that support for the family. That we can provide emergency surgeries at the health center is such an amazing amenity for our community.
I think our hospital is it plays a really big role in our community. We all need it at one point or another. I think for the hospital to be well equipped, it benefits all of us. And so to know that there are services at the hospital that we can access here in our community instead of having to drive the hour into Red Deer, I think is huge.
The health center is an important amenity to attract workers to the area, which allows us to grow and expand on our operations. We believe in supporting important community services like the Rocky Health Foundation and encourage everyone to join us. Better health care is better for the economy, and that improves everyone's quality of life.
For the last few years, the Rocky Agricultural Society has provided financial support to the Rocky Mountain House Hospital Foundation. Having this unit staffed with qualified staff and equipment is an asset for all of us. This is a plan that we all need to support and get behind. Thank you from the Rocky Mountain House Ag Society.
Without the Health Foundation, Rocky Mountain House Health Center would not be in the position it is today, and many of the services and procedures we provide to our patients would simply not be available. Thanks to you and your continued support of the Rocky Health Foundation, we are able to provide a higher level of care to you and your loved ones and reduce wait times. Your donations are important, and they are making a real difference to our community. On behalf of all of us here at the Health Center, thank you for your continued support.
I urge you to take a moment to think about the people in our community who are struggling with health issues, your neighbors, your friends, and your family. Imagine the difference that your donation could make in their lives. I ask you to please join me and the many others who have supported the Rocky Health Foundation. Your donations matter. Thank you.